This was actually a cryodilation case. I don't have a video, but it was like you said, a kind of a life-changing procedure or series of procedures for this patient. She was a 52-year-old lady who had a laparoscopic, thoracoscopic Ivor-Lewis esophagectomy, had stent placement after the esophagectomy for a presumed leak. And then developed a esophagogastric anastomotic stricture. As you can see, the inner diameter was probably less than 5 millimeters. And then over 2 years, the patient had undergone 27 EGDs, including balloon dilations, debridement, kennel log injection, stent placement. She ended up actually getting on TPN. She was having multiple food impactions. Next. And so, and this was probably one of the first cases in the literature, in the GI literature at least. And again, kind of learning this from the thoracic surgeons who had airway experience with cryodilation of airway strictures, and then applying it to their esophagectomy patients, and sort of got wind of this sort of this protocol, and then again, thinking about what we could do to help this poor lady, and started a series of cryodilation procedures. So in this case, I wasn't sure how I would know if it was working or not. So I actually decided to talk to her about doing 5 cryodilation procedures for the next 5 endoscopic procedures that she was going to have. And so that's what we ended up doing. I actually used a protocol similar to Dr. Vazakis, where it was a 20-second freeze for 2 cycles, and so she underwent that protocol, followed by dilation. And really after the 3rd round of cryodilation, the patient really noticed an improvement in her dysphagia. And then after round 5, her weight had peaked, and she was clearly doing better. So after the 5th cryodilation, I stopped, and she was able to maintain her weight. And now I still see her. Prior to this, I was seeing her every couple of weeks. But actually, if you want to go to the next slide, Winnie. Things definitely got better. And so you can see here the kind of the result after the 5th week. Things were definitely much more open. And now I probably see her every 5 to 6 months. So a huge kind of a life-changing procedure, like you had mentioned, Amir. For this patient, we were literally coordinating vacation schedules around each other. And so now she essentially was able to get her life back and actually get back to work, and it was really impactful.